can take to reduce their risks, increase their resilience to mental health problems, and improve their mental health.
Our vision is to create a world with a sound mental health for all.
People do attempt suicide.
Naturally, people are born to judge, but judging and expressing the judgment is something that we can preserve for ourselves.
We find that suicide bereavement is even more difficult than losing someone through natural death.
Be empathetic in the way you approach their situation, because if you show too much sympathy, they will also start feeling guilty.
Greetings to you all. Welcome to our show, Tap In. Hello everyone, welcome to our show. This is Tawanda Murepa. I'm your host, and today we are going to discuss about mental health in an unequal world. So as you remember, Sunday was the Mental Health Day, and we didn't commemorate it then, but now we are commemorating it today. So today in the studio, we are going to talk about what mental health is and why the world is unequal, and also what are the inequalities among mental health issues. So I have guests here in studio, and also I have some online. So I'll start to introduce the guys in studio. Starting from my left, can you introduce yourself?
Thank you. Whenever somebody goes online or stand in the public, people want to know who they are, what they do, and they sometimes even look at what they are wearing. Whilst you're still doing so, a story is told that there was a captain, an army captain, who fell in a pit, and the subordinates wanted to pull him out. He was covered by the mud. So, as you know, they are supposed to respect the captain. So each time they would want to pull out the captain, each time he would come out and they would see the nyembes, the paraphernalia, he would drop, they would salute, and he would drop down. Up until they decided to ask the captain to remove the paraphernalia. And when he did that, they were able to assist him because they didn't need to salute him. What am I saying here? I know we are discussing on mental health. I know we've got gurus in mental health. We've got people who are renowned psychiatrists, social workers, psychologists. We salute you. But today, we are saying, take off your nyembes, take off your paraphernalia so that you can be part and parcel of us and you'll learn. Good morning to those who are listening to us in the morning. A very good afternoon to those viewers who are watching us during this afternoon. A pleasant evening to those who are watching us in the evening. My name is Rachel Rashamira and I'm from Ngwanezashe Trust. Thank you.
So my introduction is not as nice as Rachel's. You know, she set the bar a bit too high. So I will just let you know my name. My name is Tanatswa Chakaura and I'm a mental health advocate. And I'm also the founder of Ndinewe Foundation.
Good afternoon, good morning, good evening, wherever you are. I'm not a captain. I'm not going to run. I'm not going to take off my paraphernalia. So, salute me. My name is Mertha Nyamande. I'm a psychotherapist and I am also director of Insight Wellbeing.
Okay, now we are going to the guest online. Can you please introduce yourself?
Thanks, Tawanda, and thanks everyone for having me. I'm so excited to be talking with you. My name is Marian Bolivar. I'm from Colombia, but I'm currently working at MQ Mental Health Research as a grants and programs manager. Yeah, that's it.
All right. Thank you, Mariana. Thank you, everyone, for introducing yourself. So today we're going to talk about mental health. So before we start, we want to know what mental health is. What mental health is, starting from you, Mr. Nyamande.
Right. I think this is the most misunderstood concept. I want to call it a concept because when you have something go for as long as 200 years and it's still not understood. I think it gets into a space where it becomes. So we've had the likes of King George. I think that's far back as we know mental health, and he's been known to have mental health issues. And because he was a king, we were not able to actually get to the bottom of what mental health is like. We were not able to investigate and interrogate the predisposition. So the bar was set. So the problem that we now have is 200 years later, we still not you don't. So you then get the likes of the World Health Organization that then come up with a very elaborate definition that is quite confusing. When I read that as a clinician, I struggle with that. Let alone somebody who's struggling with mental health issues. Are they going to make sense of it? So yes, there is a concept of emotions, behaviors, and thoughts. Okay, but when we apply those things to our day-to-day life, we don't really fit those things in as well as perhaps we need to. So when I am defining mental health to people in therapy, for example, I put it in the most simplest of ways I have thought over years. So for me, it is what you believe versus what your reality looks like. Okay?
Okay.
So if there is a wide gap between your beliefs and your reality, you're likely to struggle more.
Okay.
Okay?
All right.
But if they're closer together, you're likely to be in a much better place.
Okay.
That's my definition.
Okay. Tanatswa, I think. Tanatswa, what is mental health?
You know what? I feel the same way as Mertha when he says that the definition that is there is a bit confusing, because I find it confusing myself, especially when you want to explain it to someone using the Zimbabwean local languages. What then do you say? If we're going to talk about emotions, thoughts, and behaviors, okay, what do we then say? Because in Shona, we say utano wepfungwa. But if you just focus on utano wepfungwa, what about is that including the emotions? Is that including the behaviors, or is it just the psychological part? So I also struggle with that. But for me, I have decided to say that it's a part of me. And I usually use the analogy of a hand. I'm right-handed. If my right arm is to get injured, I want to get it treated so that I function effectively. So if my mental health is in danger, I would like to get it treated so that I function effectively. So it's not separate from me, but it's a part of me, just like a body part, and it's just as important as my body parts. So that's my understanding of it.
All right. So what's mental health?
Thank you so much. Just like what Mertha and Tanatswa said, I also find it very difficult. More so, I'm an HR person who's just interested with a passion towards mental health issues. So armed with that background, I'll try and stick to the whole definition whereby mental health is defined as a state of well-being in which an individual can realize his potential, his or her potential. An individual is able to cope up with the normal stresses that we face in our everyday life. It also is able to be productive, be it in a family setup or in a community. And just like what my colleague Tana here has just said, it's pretty much difficult when we want to get to our vernacular, Shona, to try and define kuti utano hwepfungwa, what do we exactly mean? So maybe if we can just stick to the mental or the health of our mental being. And just like what she had said, I would also want to add that to me, it is also a part of me, just like when I have a toothache, I need it to get removed. There are no two ways about it. So when it comes to mental health, I also feel that I have to get the necessary medical intervention. Thank you.
Right. You said that our definition is confusing, especially here in Zimbabwe. So, but we want people to understand what is mental health, the general populace. You said you are confused with the definition, but what more of people who doesn't understand about psychology or counseling? So having this conversation so that we can also come up with a definition that everyone can understand what mental health is. Okay, Mariana, what is mental health? What is mental health?
Well, for me, what I think that the definition that I like the most, or the one that resonates with me the most, is just to think about mental health as a spectrum. So on one extreme, you have people with a severe mental health illness that threatens their life. And then at the other side of the spectrum, you have a very positive mental health and just a state of well-being and fulfillment. And most of us, we are somewhere in between that spectrum. And at some times of our life, we can be more like to this side, towards the sickest part, and sometimes towards the most positive side. And that is important, and that resonates with me first, because that means that there is not a distinction between mentally ill and mentally healthy. We are all there in the spectrum. And secondly, because that means that regardless of where we are there, where our starting point is, we all have a journey towards more positive mental health. And there is something that we all can do to live happier with ourselves and have better peace of mind. And that is not going to be a linear pathway. It has ups and downs, but that journey and how we reach that is, for me, mental health. So.
Okay, thank you. So now we are going back to our this year's theme, which is mental health in an unequal world. Guys, what do we understand about this year's theme? Tanatswa, what do you understand mental health in an unequal world?
Okay, so for me, my understanding is that there are people that are unable to get mental health education and mental health services, yet it's their right. That's inequality, just there. There's no black and white there. And I think the inequality starts, don't kill me, with our definition of what mental health is. Because if we're going to say it's a state of well being, and we don't identify what a state of well being actually is,
Exactly.
in our culture, in our Zimbabwean context, it's very problematic, because you will then see people saying that, okay, mental health conversations are people from a certain type of class, be the rich people. Those are the people that have mental health issues, yet us from disadvantaged backgrounds, we don't have them, which is not the case. So it really does start from our definition, and it's us not truly understand. Maybe we don't even understand what mental health is, because I've seen so many people confusing mental health and mental health issues. People don't even know the difference. Yet your mental health can be positively affected or negatively affected.
Exactly. All right. Okay, Mr. Nyamande, can you add on that?
Well, I want to go back to Utano Wefungwa and just try and get us to think. Because I think there is also a confusion here. We confuse Fungwa Nenjere. A brain is very different from the mind. And sometimes we don't really understand the difference between those two things. So when we then come to basically what Tanatswa has been saying about the equalities of the other side of the world, has a lot of resources for research, education, service provision, all those things. Yet the other side, the developing world, they hardly have enough money to find a meal for the day. So then we have to think about then how do we then equalize an environment where one is right at the struggling to meet the needs right at the bottom of the Maslow's hierarchy of needs, the basics. We can't even provide the basics. Yet we are thinking, how do we equalize that with self-actualization right at the top of that hierarchy? So it's all about resources from what I'm looking at it from this perspective to say, there is developing world, there is developed world, there is something in, I'm not sure if there is, but I think those are the two spectrums. I think going back to what
I think
Marian
I need to
was
cut you
saying.
there. Mariana, what do you understand about mental health in an unequal world?
Well, that is, I mean, it's just such a complex and fascinating issue at the same time. One of the things I completely agree with the one that is just, you can see like the difference of how some people in the world are able to have mental health support and some others just like have no access whatsoever. And also with what Mertha was saying of is related to practical needs, to practical inequalities that go beyond mental health, and they go with economic inequalities, with education inequalities, and in many other areas. So mental health is a reflection of that, and is a reflection of inequalities at the international level, as it was saying, between the developed and the, well, I don't like the developed part, but just like the high income countries and the low and middle income countries. And also internally, because internally inside each country, we all have like our own inequalities. I come from Colombia. That is it's a middle income country, which means that it has kind of a little bit of both, and it's highly unequal. I have the experience from here in the UK, and I see that is very different in terms of resources and support and many other things, but at the same time, the dynamics of reproducing the internal inequalities is the same, both in Colombia and in here, from my perspective. And
Thank you. You're saying the inequalities in UK and in Colombia are both the same?
Well, they are not the same because, of course, Colombia is very much more unequal than the UK. But there are inequalities in the UK. And here there is a lot of evidence saying that people from disadvantaged groups, from minorities, from ethnic minorities, from low resource settings, they have worse mental health outcomes. And they also, as Tanatswa, sorry that I'm trying to pronounce well your name, was saying, those are the people who have more issues to access support. So then it becomes this cycle of you have worse mental health, but also you have less support. So then that feeds into a bunch of circles of poverty, addiction, and many other problems.
Going to call you elder. Yeah, so I'm going to call you elder. What do you understand about this year's theme, mental health in an unequal world?
I'll put it in the layman's language. How I understand it, I'm going to say it out by the use of an example. Here in Zimbabwe, you'll find out that people in the dells are the ones who can easily access mental health services. Recently, we have learned from the statistics being put in the press that there's a sharp increase in mental health problems, especially in the youth, and institutions such as Parinyatwa groups of people, groups of hospitals, Salimu Gabe, maybe Ngomauru in Mashingo, they are inundated by admissions. And those are the cheap areas where many people can easily go to. And I did a cross section of 3 halfway houses in Harare, and they are charging between 550 USD per week. And one who is admitted in such an institution needs to be there for about 6 weeks. So one wonders, kuti a person from Usumba Maramba Pungwe there, someone in the rural areas, are they able to access this? Or maybe there'll be like some of the children that we later rehabilitated at Ngonizashe who were just being locked inside their homes because they cannot access help or assistance in mental health problems. Thank you.
Okay. All right. You mentioned something to do with the state of mental health in Zimbabwe. All right. My question was, what do we understand about the word mental health in an equal world? I checked the website, the WHO website. They were talking about COVID-19 and how it impacts the issues to do with mental health, and also what Mr. Nyamande highlighted. There's the issue of classes in the, we have developed countries and we have low-income countries like Zimbabwe, and how the world is unequal in terms of maybe the service providers, in terms of the knowledge, in terms of the institutions that we have here in Zimbabwe. So let's talk about the state of mental health in Zimbabwe. Tanat, what is the state of mental health in Zimbabwe?
Okay, so Tawanda, when you say Mr. Nyamande, you make it seem like I'm so disrespectful because I'm saying Mertha over here. Like, come on. I just want to comment on what Rachel said, on how people in the Madel, they'll have access to mental health services. So there are issues. There are about 3 groups of people in Zimbabwe. I hope there are 3, if my math is correct. There's a group that can afford mental health services, but cannot access these mental health services because they are just not there. And then there's a group that can access mental health services, but cannot afford these mental health services. And then there is a group that cannot afford or access mental health services at all, even the mental health education. Now that is inequality right there. Where these groups of people are, they're all over Zimbabwe. They're scattered all over. Some people in the marginalized communities, those people that are in the Madeldels, some may be able to afford, but they just don't know where to go to because the services are not there. And there are 2 main issues that I've discovered we have in our country, and that's affordability and accessibility. Those are major issues. You can afford, but if you cannot access, then what can you do? Where will you go to? I think in our country we have 6 public institutions with psychiatric beds, if I'm not mistaken. And we have a population of 15 billion. Is it billion? Million? Million? Billion?
It's a million.
I meant million. I meant million. It's not a B, it's an M. We have a population of 15 million. Million. So, I mean, that's not a lot. That's not a lot of institutions. Yeah.
Okay, Mr. Nyamande, add on the state of mental health in Zimbabwe.
Billion. Right. So I'm fascinated by the way that, if I go back to my definition about beliefs, I'm fascinated by the way people in Zimbabwe hold their beliefs. There is a lot that is leaning on the church, and there's a lot that is also leaning on the traditional, I don't know what to call it, traditional medicine, traditional beliefs. Yeah. So even as I was coming here, I heard people talking about Agaroiwa. And I suppose if you're looking at somebody who's struggling and you then lean towards Agaroiwa kanota kutanda botso or anengozi, those kind of concepts, it's very difficult then to translate that into mental health because your understanding is such that it's been caused by someone or something, and therefore none of this Western ideology, because this is how we look at a lot of these things. This is a Western ideology. None of this Western ideology is going to undo kuroiwa kwa Gaitwa. So we go to Nganga or Mapostor or Maporofita. So this is where I am seeing an element of inequality as well, because we are not understanding these things from a well-informed position, because the element of have I said something that upset you? I do apologize if I did.
No.
However, yeah, so the element of our beliefs versus our reality and the things that we have been taught to believe to be right or to be absolute are the things that I think are keeping us where we are, rather than more than accessibility or not, because it starts with what you believe and what kind of help you're going to look for.
I would like to disagree with Mertha.
Nothing wrong with disagreeing.
Do you know what? I feel like I get where you're coming from. And I always say to people in conversations that there's nothing wrong with Western ideologies or Western psychology and, trying to bring it to Zim or using it in Zimbabwe. The problem is when we don't adapt and adjust it to fit the context we're putting it into. And I think as mental health practitioners and advocates, we struggle with putting mental health into context. We forget the culture that's there. We forget the beliefs that are there. And I don't think that is fair. I don't think that works. There's a group that believes in Kuroiwa. And there's nothing wrong with that. It's okay. That's what you believe in. So what model can we then create to fit you and to ensure that your mental well-being is catered for? And because we then as mental health practitioners say, okay, people are saying Kuroiwa, people are saying Kutandabotso, people are believing in church too much, so we need to perhaps change, and I quote, change how they are taught. If we then say that, we are never going to go far because it makes it seem like we're trying to replace what has already been in place or replace the Zimbabwean culture. If we go to a traditionalist will tell you that, before you were born, mental health was there. We didn't know that it was mental health, but it was there. Perhaps if our child was schizophrenic, for example, we would use salt. Put salt underneath the feet. Would use, I don't know if it's forjiga. I don't know what forjiga is in English. Sorry, Marian. But we'll use forjiga, right? Or something like that. They will tell you the steps they took and it worked for them. Now, my question is, why is it us as mental health practitioners, we're not asking ourselves, how do we fit models to the context or to these beliefs? Why do we want to change it? If someone used salt, okay, why don't we want to understand why they used salt? That's inequality in our thinking, I feel.
Yeah. So just to add on to that, I'm with you. I understand. It's not a disagreement, and I think it's an addition to what I'm saying. I'm saying, and this is why I went back to the definition is about beliefs, regardless of what those beliefs are. Yeah, it's about your beliefs, what your beliefs are, whether you believe in having 3 stones in your pocket and have good luck, yeah, and that works for you and that's giving you a sense of safety, that's okay. But if you have those 3 stones in your pocket and you still don't feel safe, then we've got a problem. Yeah. So it's not about which beliefs we're working with, but it's about whether those beliefs are helpful. I think that's where I'm at.
Thank you so much. I've been following the debate between Mertha. And after following it closely, I've just seen that you guys have decided to you have agreed to disagree amicably, like what the late Professor Kamba once said. And so I'm not going to add on to that, but I just wanted to also add on, Tawanda, to say the issue of mental health inequality also arises from the fact, the historical marginalization of mental health services into the mainstream healthcare. I want to further go on to say, look at the clinics, primary health care, in the rural areas. You hardly find a mental health professional there. Even if you want to look at the mental health institutions that are there, they are mainly in the urban areas and in major cities. That is Ngucheni in Bulawayo and Salimu Gabe here, annex in Paranyatwa. Already, it's creating some inequalities. Yes, and also, if you want to also look at it, it's by annex, which is attached to Paranyatwa, whereby all ailments are treated. So would want a situation whereby there is a mental health institution that is set specifically for that and not attached to Salimu Gabe Hospital, but something that is there. Isolated, yes, mental health. Thank you.
Okay. Thank you all for your comments. Now we are going back to Mariana. Mariana, what is the state of mental health in UK? And also, you can also explain further about in Colombia as well.
Well, I mean, I would not be like able to say like to comment about like the mental state in general. Of course, across the world, there has been these issues with the pandemic and the crisis and the problems that come with it. In most of the countries, like just going back to the spectrum of mental health, like if we were here or somewhere, we moved a little bit like towards the worst mental health. So that has been a consistent topic here. Just like to connect with what is the state of mental health like in different contexts, and just to connect with the conversation before, is that I think that traditionally there has been this view that the Western science, that is knowledge, and that has to be just like transmitted to other people in other countries, which is sometimes not very effective, partly because it's not contextualized as they were saying before, and because and also because sometimes it's just like very dependent on medicine, like clinical medicine, on pharmacological solutions, or just like therapeutical approaches. And there is increasing evidence, or we know more that even those approaches are important, and I don't want to underestimate how important they are. And they are very, of course, like more important here that the health systems have more resources. But schools interventions, like schools systems of support, they have shown to be very effective. Parents that have like more skills to support their children, those are also very effective. Changes in behavior and physical activity. So there is a lot to do in mental health that is not dependent necessarily on having a lot of medical infrastructure and professionals. And there are a lot of community health workers. For instance, in Colombia, we because we had this volunteer project, we were providing free psychological advice to people through digital platforms, and providing them with useful information and trustable information about the pandemic. And one of the striking things is that in Colombia, because it's kind of a middle ground, so there is money for research and there is some money for investing in mental health, but there's still like a disconnect between the higher levels of the population and the lowest. So then the research there is more focused on solutions. Yeah, well, just not to be long.
I think I need to catch it there. She challenged us. She said that there's a lot more to do than looking at the big institutions. Like as individuals, we have a role to play than looking at the big institutions. Like, well, the government is doing what, the government is not doing this. What are we doing as people to make our mental health state maybe into a better place? So I think that's a challenge, especially here in Zimbabwe, because we usually blame and point to those in charge or to those institutions. So it's a conversation. And okay, there's something. Yeah, there's a problem. So okay, Tanatswa.
Just to comment on what Tawanda said, that we usually blame. So I'll talk about our Generation Z. I'm sorry if you're not in it. And people usually say that our generation is so entitled to wanting things, and we always blame people. We always blame, oh, we're not getting this, we're not getting these opportunities. But my question is always, okay, was this generation ever given that platform to thrive and grow and get those opportunities in the first place? Is it complaining, or it's just stating the facts that this is what's happening? I'll give you an example of a major inequality that is there.
Okay.
There's the issue of unemployment, correct? And we've got young people that will apply for jobs and not get them. Perhaps they are not getting them because their CVs are just not up to par. Who's teaching young people to write these CVs? Do we have those institutions in our high schools teaching young people to write a CV? In the rural communities, is anyone going to young people and telling them a CV is supposed to look like this? I looked at some CVs, I think it was about 2 weeks ago, 3 weeks ago, when I asked some students to send me their CVs for attachment. And it was terrible, I'm sorry to say. It was just not it. And who is going to do these things? Whose job is it to do these things? Okay, if it's the school falls underneath who? Exactly. So when you say we are blaming, are we blaming them? I don't think it's blaming. I think it's stating the fact. There's a difference between someone blaming and saying you're doing this, yet you're providing the things, and we're saying, Tawanda, you're just lazy, you're not doing you're not doing what you're supposed to do. As opposed to me saying, no, I'm not lazy, you're just not giving me what you're supposed to give me. It's like saying a baby is blaming the mother for not getting milk.
I cannot not like loud enough to everything that you were saying. It's like, yes, definitely. and sorry, just I know that you're passing the mic, but just a small comment on that. Teaching like basic skills that are useful for life, problem solving, making a decision, coping with stress. Those are things that we could all learn. And that they are not dependent, they don't require to change your religion or your belief system, but these are just like basic skills that can help us all. And as Tawanda was saying, like you just need somebody to bring this knowledge to someone in a context appropriate way. So I think that is an area of a promising area of work. Sorry that I interrupted you. I just kind of took the
Now let us talk. I think I skipped some comments. Let us also discuss about the inequality, about what is the common mental health problems? What are they here in Zimbabwe? Can we name it? Do we have names for those common mental health problems? And how best can we name it so that an individual outside in the street can understand that we are talking of depression, we are talking about stress, we are talking about bipolar? What are those common names that we use, let's say here in Zimbabwe? Exactly, so that someone can understand. I think we need to talk about it so that people would understand.
So I don't want to talk about me, but I'm just understanding this system. But having listened to what has been on the ground for the past few months, I've heard the Friendship Bench has been talking quite a lot about a local concept or a local understanding of depression. Yeah, putting it as kufungisisa. I'm not sure. I'm not sure. I'm not sure that's from what I understand depression to be. I don't think it's anywhere near that.
Yeah, yeah. Exactly.
So I struggle with those kind of concepts that we have on the ground, explaining something that is actually not what we are trying to address. So I think these are some of the issues that we have, that we haven't got clear definitions of what it is that we're talking about. What is depression? What is anxiety? What is panic attack? Actually, the other thing that I'm also finding, there are a lot of people who are presenting with panic attack issues, but they've been told that they have asthma. And I'm like, okay. So we've got all those kind of issues that over generations, I think we have avoided dealing with mental health issues, and we have named them, associated them with physical health issues so that we stay away from the shame and the stigma that is mental health. So I think what we need to focus on right now is, as a nation, we need to be able to identify our institutions and our illnesses to a way that the local people will be able to understand. So I think we need a lot of work. For starters, for us to go around and asking people, because even the issue of depression, I think it has become an identity for us. A lot of us, our parents, have grown up in depressed situations. They've grown up in homes that their fathers had PTSD from the war. And they've grown up in those kind of environments. And for them, it's normal. So how do we conceptualize that to actually help people to say, this is actually not normal? These are the things that we are talking about as mental health issues. So like what Tanatswa was saying earlier on, how do we meet people where they're at, saying, no, this is normal, when it's not? How do we question that in a respectful way?
Okay. Yeah. All right. Chief, anything to add on, Elder?
Thank you so much, Tana. Yes, I'm affectionately known as Elder from the youth circles at my church. That's why it's constantly calling me Elder, and I love that name. I would want to agree with what Mertha has just said. Our major problem is of defining. How do you define depression in the vernacular? Same with Zungu. We go to the doctor and we say dizziness, but does it really explain how I'll be feeling? Because in order for somebody to deal with mental health struggles, he has to know the source. So now if we tell them that you are too anxious, what is it that we are saying to them? You are depressed. What is it that we are saying? Are we going to maybe say your lack of focus? But we have some who've got lack of focus, but won't be necessarily having some mental health problems. Maybe they are not. So how then do we really get to realize? How do we really get to educate a community? And then on what Mariana said, I want to say, Mariana, I take up the challenge. I'm actually in the process of wanting to venture into establishing a halfway house, and I hope I'll get there. But having said that, still, I would like to agree with what Tanatswa was saying. Zimbabwe. Agreeing to disagree amicably. Amicably. Especially if you want to look at a country like ours, Zimbabwe, which is in Africa, which was already facing or which was gripped by economic challenges even well before COVID-19 pandemic struck, would still expect more from the powers that be, that they go an extra mile. Especially, I was following ardently to what Mertha was saying, who's in the field. There is need for increased awareness. Some may even keep their children in the home saying, oh, okay, we'll lock them up. I still remember back then when we were growing up, there used to be an organization, I'm not too sure if it's still there, called Simke Trust. And people used to label. They would say whenever they see a bus transporting those kids, they would say, Masaskam. That was the term they would use. So there is need for education on our part, increased awareness on the populace of Zimbabwe, that we get to really know that some of these challenges can be dealt with medically. So would need to see even TV shows being funded. The likes of Wellbeing, of the Ndaremerwa fame, if such musicians are funded, Tawanda, it will trigger all the other musicians to also sing along the mental health struggles, issues, and we'll get somewhere. And also, I would expect, that's why I said I'm begging to deviate a bit from Mariana, to see our government maybe reviving the recreational activities, because back then we used to have parks, though of course we only know of Harare Gardens, Africa Unity Square, but would love to see recreational activities being put in place. I would want to give, for example, if you go to South Africa and in Soweto, you find a lot of green spaces whereby the young ones can play soccer, they can do sports, something that should be next given the unemployment rate here in Zimbabwe. So one won't be confined to just being there without employment, being stressed. But if we can have such institutions as well, that would be great.
Just to add something to what Elder said, when we have these mental health conversations, we always say we want to have honest conversations, but I feel like we're only honest to a certain extent. And I don't really want to get deep into the issue because then we'll be here for 2 more hours. But I think it's very important for us to not leave anyone behind and to address, what issues are making our fellow countrymen and women, happy and unhappy. It's important for us to, always, and, not taking anything away from what Elder said, but it's not fair to only say our vernacular is Shona because we have 16 official languages in Zimbabwe. So when we are now going out there into a country, we need to cater for the other 15 languages that are not Shona. And we need to then address why it's still such a big issue that, it's always just Shona, 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 and it's never Shona. It's usually Shona and Ndebele only. And we don't talk about Tonga or Venda or anything else. And we need to understand why that is, because not having those conversations also leads to various mental health issues. And inequality, and inequalities. I mean, we won't get deep into it because, but I just wanted to throw that in there.
And just, can I comment on that?
Yes, you can.
So one of the things is I completely agree with there needs to be more investment in activities that promote good mental health, green spaces, activities, hobbies, just like things that we know that are positive. I also think that that just like this conversation, basically, that we are, like, how often do we have the chance from somebody from Latin America and somebody from Zimbabwe just sharing experiences, saying like, oh, this is it. I realized like so many things that I didn't know, and just like these exchanges, they are so useful, and they really make you think of mental health in a different way. So that is just one part. And then secondly, I think that the knowledge that mental health workers, that the organizations that are just kind of working in and supplying kind of the responsibilities of the state in providing these services that the state is not providing, there's a whole lot of knowledge there that can be scaled up, that can be improved, that other contexts and other communities that face similar problems can learn from. So just wanted, well, because I know that time is short, just wanted to invite you all just like to keep the conversation going, to talk with other, happy like from my side to promote further dialogue with other sectors, with other countries, because I think that we just have a lot to learn from each other.
That's true. Thank you so much for highlighting that. But I was yet to ask the question of what we can do. But our guests are so forward. You're forward. All right. So I'm sure you mentioned something that about what we can do as people or as organization and as a nation as well. So do you have anything to add on what we can do, Mr. Nyamande? I think you're the only one who have to comment on that one.
Well, yeah, I think the ideas of green spaces are crucial, but I think we also need to go beyond that. And I think one of the things that affect people on an individual basis is their confidence and self-esteem, which are undermined by not having a certain level of access to certain skills, certain abilities, certain pieces of education that are not necessarily formal. So, for example, when you're looking at this is where children learn, and if you're not given that opportunity, that is not only going to affect you not being able to socialize with other kids, but it will affect you as well, how you then socialize with other adults and be able to work together with other adults and cooperate without being as antagonistic. Yeah. So I think beyond having green spaces, I think we need a lot more in terms of skills training. So whether that is on a vocational level or whether that is on an informal level, whatever level it is, we need to start building skills, having these young people, especially, because I think it's a little bit too late for me. So let's give the young people an opportunity to have these skills that are going to empower them to be able to sit in the room at the IMF and challenge what is being said on the ground, rather than, no, it's the boss who said it, so I am not able to challenge that. Because this is the other issue that we have as a culture. What our elders have said. This is why I'm not calling you elder, because I want to be able to disagree with you. What our elders have said, we cannot challenge. Whether it's right or wrong, we just go with it anyway. But if we're able to express ourselves and question those things and challenge those things, and it's not wrong to challenge each other. It's healthy when we can challenge each other as well as support each other in various institutions. But it's about having those young people especially to have those skills. Charity begins at home. We have to empower our children from the grassroots to be able to express themselves what they want and need, not because dad said so, not because mom said so. If it's not working for us, we need to be able to have an open space where we can safely express ourselves. Otherwise, without learning to do that now as children, we're not going to be able to do that later as adults.
Okay. Thank you. All right. Okay. Thank you so much for highlighting that. You mentioned the issue of keep them young. We should educate the children at home. So I think the first step that we should do also is to educate the parents so that they understand the signs of mental health issues or mental health problems, and then they can talk to their children. And we should also have peer educators among the children. You know, it is much easier for another kid to open up to another child. You know, so I think that's also the way that we should do as here in Zimbabwe. And also, what is I like this say what, you know, say what is advocating for SRAs using young people or students from universities. We should do something about it at our mental health issues, especially on our university level, whereby we educate people, we send peer students to talk about mental health among the students, so that I think we can cover up that gap that we are having here in Zimbabwe concerning mental health problems and issues.
Yeah, I think from what you just said, so I think from what you've just said, catch them young. I think this is a crucial step, but it's not isolated. You can't catch them young without their parents. This is where we need family services as well. We need family support services so families are able to understand what their role is as parents. It's not just providing education, sending a child to school with clothes and food. It's also about encouraging them and empowering them to be able to stand out and, as I mentioned earlier on, express themselves, challenge things that are wrong, so that we can help each other correct those things.
Okay. Before that, I want to. No,
It's one
no.
point.
Okay, all right.
It's in this.
Okay,
I'm
go
not
ahead.
disagreeing. I promise. I know. I know when I disagree, I speak a lot, but it's one point. Okay. So I just want to agree with him and with the both of you and say let's catch them as young as before birth. When a woman is pregnant, you tell her how to breastfeed. You tell her what she should do. Let's also do the same. Let's tell, with regards to mental health issues, let's tell pregnant women about mental health issues. Let's tell them about postnatal depression. Let's tell them about prenatal depression. Let's tell them about how to raise their kids to ensure that their mental well-being is made a priority. Let us do these things. Please, doctors, hospitals, everyone who deals with pregnant people, please tell them about these issues, because when they give birth, they're then able to remember, okay, perhaps this is how I should take care of my child. During that whole period, there's the whole attachment issue that happens. And the first 5 years, that's when a child's personality is developing. And it's very critical for parents to know how to interact with their
Okay, before Elder, okay. I want to hear something from Mariana. And she mentioned something to do with the mental health state in UK is better. What are you doing, or what is being done in the UK that you think you should be done? We should also do here in Zimbabwe.
Well, I mean, it would be difficult for me to say that the mental health state is better. There are more resources, definitely. But I think that one of the things that can be done, there are things that to be done in the long run, and there are things to do just like short gains that can be cost effective. And they are all important. So investing in the right resource, in having the infrastructure, in having the medical resource is very important, because some people need it. I just want to, this is partly, it's a debate still, how much medicine itself, like from the pharmacological point of view, it might help a lot of people. There are some people who don't. So roughly there are 50% of people who find a right treatment for depression, and there are 50% of people who don't. So, but there is more evidence that family approaches, so community approaches, school approaches based on health, on building those skills that you were all mentioning about, have very good outcomes, generate a very good impact. But then this has been mostly studied in high income countries, in the UK, in Europe, and we need more evidence from what work in contexts like Zimbabwe, in context from impoverished communities. What community approaches can be there? What can we done, and just like work with the people and with the communities, and not just like go and tell them what to do, but that is a more collaborative approach. I think that would be just my main goal, just like to work together, to bring, maybe there are some resources from other country, but then the knowledge from other, and then the community. So it sounds cliche, but it's just like working together really. That I think is a very promising approach, and just strengthen those communities and the families and the carers in their mental health literacy and skills is something that I think is promising, both in high income and low income contexts.
All right. Thank you. And because of our time, we should actually try to to recap. Okay, so maybe everyone should comment, and then I'll conclude. Last
Right.
comments, please. 1 minute. 1 minute.
Now I feel discouraged. I was gonna have a minute and a half, but hey. Right. I was just gonna add a little bit more on what Mariana said. I think the issue of better is very relative at this point, because as I mentioned earlier on, I think globally we're still struggling with understanding mental health. So whilst the UK, unfortunately, I understand the UK system better than I understand the Zimbabwe system. So whilst the UK has more resources, you can put resources to a system that is not understood and still not achieve the right results. And
Completely
still,
agree.
and not have resources and have better outcomes. So this is the issue that's at the core of this discussion, that it's more about being able to understand what mental health really is about, and what we can do comes from that understanding. I'm going to leave it there.
He said 1 minute. Okay. Okay, so let me try say what I want to say in 1 minute, Tawanda, before you kill me. I just want to say that let us all be kind to each other. There's so many inequalities that are out there that are, preventing people from having access to mental health services. And it does not help if us as people put each other down. Let us be kind to each other. When I founded Ndinewe, the idea was always to just say to someone, you're not alone. I'm with you throughout the whole process. I'm there for you. Doesn't matter whether I'm a mental health practitioner or not, but you are not alone. And I hope that amongst young people, we can spread that message and people can know that they're not alone. And I emphasize on young people because a lot of young people are dying from suicide. A lot of young people are struggling and we don't know where to go. We don't know where to turn to because the people that are meant to be there for us don't understand what mental health is. So it's our responsibilities as the youth to be there for each other. And I hope that we will never forget that.
Okay. And Tawanda,
Elder, 1
as an
minute.
elder, I cannot go without giving the viewers a verse. 3 John chapter 1, verse 2. God desires us that we prosper and be in good health, So just like what we've been trying to deliberate, the individual is the most important. Yes, we spoke about what we want the government to do, the civic society to do, but the individual denial will cost us. We need to start accepting that mental health challenges do exist in our families. We educate our children, and then we can see us going forward. We need to start making noise as a nation, the same noise that we made uh, during the COVID-19. We're still making the same noise. If we could make noises from our homes and the radios, road shows, everywhere, we have to be making noise about mental health in the rural areas, all areas, so as maybe to try and keep the inequalities that have been created. Thank you.
Okay, thank you, Elder. Mariana, do you have anything to add on? Just a minute, please.
Well, no, actually, I'm not going to add anything. I just agree with that, and just to thank you all for having me in this conversation. It's been really a pleasure, and I hope that we just can keep learning from each other. That's it, really.
Thank you to our guest. So I want to conclude a bit from what you were saying. Mental health is important, right? And we should take care of our, we should try by all means to take care of our own people, especially young people. Should also engage into the activities to do with mental health, to promote actual mental health. So, I'll be reading this statement. It's we are starting an initiative that we are starting. One of the things that we need to do is to address inequality, mental health inequality uh, of African community, in a more visible way, that the global community can also understand our conversation about mental health and also the solutions that we can use or that works for Africa. And that's why now that's why Young People Mental Health Trust, we are collaborating with Mariana in a very exciting initiative called the Health Brains Global Initiative, where everyone will be saying something about mental health, about what they think the research in Africa should go or should focus on concerning mental health issues. So this will be launched in the first week of November, and it is very important that mental health needs of Zimbabwe are visible to the world, and so that so please go to our page, your pet health, and also go to MQ page on Facebook, on Twitter, so that you can participate on this initiative that we are starting, specifically concentrating on Zimbabwe's mental health. What do you need to be? What is that we should do so that the global community can know about what is going on, and also about what to focus on when we are looking at Zimbabwe or Africa as a whole. And I'll add on the things that we can also do. I'm a mental health advocate, and I'm the also founder of Young People Mental Health Trust. We have been doing a lot of initiative concerning young people's mental health problems and disorder, whereby we are using WhatsApp platforms to raise awareness in the community, also to engage in each and everyone. We are trying to reach out to young people using WhatsApp services that are free, and every young people can also access WhatsApp platforms, and they can talk to us and communicate. So we managed to to create 9 WhatsApp groups. All of the 9 WhatsApp groups, we have people over 247 people, which is a total of about 2,500 people that we raise awareness each and every week. So we reach out to a lot of universities. We also reach out to primary school kids and their parents at the communal level. So I think we can also do more. And Tanatswa is coming up with her own organization. She also promising to do well, concentrating about young people's mental health. It's time for young people to raise up, and it's time for young people to discuss about issues that affect their other, peers. So we need to raise up as young people. It's also a challenge that you are sending to Africa, that you are sending to the world, that young people, this is your time to do something about mental health. Do we have any comments? So that if not, okay, so it's fine. Thank you for watching us today. This is our show. Tap in. We'll see you next time.